Hey everybody, it's Dr. David Drawn from Vein Specialist of the Carolinas. I'd like to talk to you a little bit about varicose veins. Varicose veins are nothing more than just enlarged veins. Now what makes them varicose is that they not only enlarge, but they also get twisty and ropey. The reason they get enlarged is the same reason a water balloon blows up. It gets more pressure inside. So the more pressure inside the vein, the more it enlarges. The symptoms of varicose veins can be nothing more than the visible signs of a bulging vein or spider veins. Everybody pretty much knows what a varicose and spider vein looks like. Many people have these and have zero symptoms, no pain, no swelling, no itching, nothing. They just don't look good. But lots of other people do have symptoms associated with them, such as pain, achiness, heaviness, itching, swelling, stinging, burning, tingling, nighttime leg cramping, restlessness. All of these things can be a sign of venous insufficiency, which is the medical term for when the veins aren't emptying good. And when they don't empty good, then they get overloaded and they enlarge. So if you have varicose veins or spider veins and you don't have any other symptoms, they just look bad, you really don't have to go to any lengths to do any kind of diagnostic workup. But if you have any of those symptoms, which a huge percentage of people with varicose and spider veins do have those symptoms, and many doctors just tell them don't worry about it, it's cosmetic, but nothing can be further from the truth. When you do have these other associated symptoms and the presence of varicose and spider veins, then the number one thing you need to do is see a vein specialist and get a leg ultrasound. Now, you can't get this leg ultrasound by your regular medical doctor or at the emergency room or the urgent care. These ultrasounds have to be done standing up. And the ultrasound that we do standing up, we collect about 4 times as much information as you would get if you go to a hospital or emergency room and just get a regular ultrasound. They're basically going to look for a blood clot and that's it. We're going to look for blood clots in both the deep system and the superficial system. We're going to look for venous reflux or broken valves in the deep and the superficial system. And we're going to look for upstream blockages in the leg and pelvis area. If you do nothing, varicose veins will not go away. They will either stay the same or get worse. The number of treatment options for taking care of varicose veins has just exploded. We have all types of things we can do. The great thing about this is none of them require an incision bigger than 1/8 of an inch. If you don't have symptoms, then the treatments are usually pretty simple and straightforward, and it may be nothing more than sclerotherapy, which is an injection of a drug into the vein to destroy it. Many of our patients, once they've got their legs treated and they want them just to keep looking good, then they just come back every year or every couple of years and get touch-ups on the spider veins that show back up. And if you have major leg symptoms, then our goal is to fix those once and for all. Even though little things may come back like spider and varicose veins, the underlying cause should be permanently fixed. If you have no symptoms other than the ugly appearance of the veins, insurance will not cover it. Medicare will not cover it. But if you have symptoms, and if we can diagnose venous reflux or broken one-way valves on an ultrasound, and if you wear medical grade compression garments for a period of time that they determine necessary, and if that doesn't take care of the symptoms, then all of the treatment would be considered medically necessary, including the sclerotherapy for most patients. Leg ultrasounds are nearly 100% covered by insurance. I can't think of a single time when one hasn't been covered. Again, this is Dr. David Drawn with Vein Specialist of the Carolinas. And you know, all I do is veins all day, every day.